For COVID-19, there are no specific vaccines and therapeutic agents. The occurrence, development, and prognosis of this infectious disease largely depend on the individual's immune function, nutrition, and health status. Therefore, it is very important to prevent the occurrence of COVID-19 and to improve its resistance to disease through rational diet. Nutrition and immunity, infection risk, and severity are inextricably linked. Malnourished individuals are more likely to suffer from a variety of bacteria, viruses, and other infections. On the contrary, chronic or severe infection will further cause malnutrition or deterioration of nutritional status. Therefore, during the new coronavirus pandemic, we must pay attention to our diet and nutritional status. In addition, the clinical course of COVID-19 disease is more serious in the elderly and some patients with nutritional-related chronic disease, such as diabetes, hypertension, and cancer. Although there is no data available, concurrent infections such as AIDS may also be associated with more severe clinical outcomes. And ideal nutrition plays an important role in maintaining the health status of infected people. A health diet emphasizes the consumption of fruits, vegetables, whole grains, beans, and nuts, moderate consumption of fish, dairy products, and poultry, and limits the intake of red meat and processed meat, which refined carbohydrates and sugar. Dietary fat should be mainly liquid oil, such as olive oil, soybean oil. A diet will provide ideal macronutrients and essential minerals and vitamins. Eating high-quality foods derived from protein, fat, and carbohydrate can help the body maintain a healthy weight and maintain good metabolism. Now, it is not the time to strict food restriction and quick weight loss. If someone is infected with the COVID-19, he should get enough energy from the health diet to avoid accidental weight loss. A healthy diet provides enough minerals and vitamins to help the body produce enough immune cells and antibodies, which play an important role in the body's immune response to infection. Zinc is an important component of many enzymes and transcription factor in human cells. Insufficient intake of zinc will limit the ability of individuals to fight infection. A meta-analysis of multiple meta-analysis and randomized controlled trials showed that oral zinc supplements could reduce the incidence of acute respiratory infections by 35%, shorten the duration of influenza-like symptoms by about 2 days, and improve hair coloring. In addition to the United States, these studies have been conducted in several low and middle-income countries such as India, South Africa, and Peru. The dose range of zinc involved in the study ranged from 20 milligrams per day to 92 milligrams per day, and the dose of zinc supplements did not seem to be the key factor in determining the effect. Vitamin C is a cofactor of many enzymes. It maintains its reduced by chelating with metal ions and enhanced the functions of many enzymes in the body. It can also act like an antioxidant to limit inflammation and tissue damage associated with immune response. The researchers evaluated the effectiveness of vitamin C in soldiers, boys, and the elder in the United States, the United Kingdom, and Japan. These studies have shown that vitamin C supplementation can significantly reduce the incidence of respiratory tract infections. Some scholars have also studied the effectiveness of vitamin C in a hospitalized patient in the United States, Egypt, and Iran. Patients were hospitalized for various reasons, including severe sepsis, postoperative complications, burns, and heart disease. In these patients, vitamin C has been shown to reduce the length of stay in intensive care units and reduce the needs for mechanical ventilation. The dose of vitamin C involved in the study ranged from 1 to 3 grams per day, and the dose did not seem to be the key factor in determining the It should be noted that in addition to medical care, individuals should avoid taking more than 2 grams of vitamin C per day. Vitamin C supplementation reduces the risk of acute respiratory infections, most of which are thought to be caused by viruses, by 12% to 75%. These studies include seasonal influenza and pandemic influenza caused by H1N1 virus in 2009. Evidence of the health benefits of vitamin D supplements can be found in patients of all ages and individuals with chronic disease. In those who are infected, if they take more than 1,000 IU of vitamin D, there will be fewer flu symptoms and shorter recovery time compared with individuals who adequate vitamin D. Vitamin D deficient individuals benefit more from the nutrient supplement. It is important to maintain adequate vitamin D levels. Exposure to the sun is a common way to get vitamin D, but at the end of winter and spring, with a decrease of sunshine, the vitamin D content in blood will be lower. If you stay indoors, the level will be further reduced. Considering that blood tests usually cost more than supplements and maintaining adequate vitamin D has other benefits. Therefore, taking vitamin D supplements is reasonable for most people. Many people are unable to meet the national dietary guidelines, which are usually limited by the availability and cost of meals, and such diets do not provide the optimal dose of essential vitamins and minerals. At present, the new crown epidemic may expose more people to the risk of food shortage, making healthy eating more difficult if the supply and logistics of daily necessities are not guaranteed in the risk mitigation strategy, or if the outbreak affects the productivity of the agricultural sector, then this possibility will become more and more serious.